Positioning, positioning, positioning. So as important as this is in adults, it's also very important and arguably more important in children, because you may fail at your BLS maneuvers of BVM with poor positioning. So the sniffing position is still our goal, but for kids, it's kind of a 3-step method to get them there. So we want some simple extension. We're going to place a roll under the shoulders, and we may need to add a headrest as well. So you're going to think about 3 things. So one is the chin plane. So you want the plane of the chin and the face to be horizontal to the ceiling. Number 2 is the neck. You want the neck opening to be nice and wide. You don't want that chin dropping down towards the chest. And then you want the external auditory meatus and the suprasternal notch to be in line. So for different size kids, this may mean different padding and configuration. But as long as you're thinking about these 3 factors when you're positioning your children, you'll be able to get them there. So look at step 1 in the left upper corner. So the first thing we want to do is simple extension. So if we just stop at extension, we're not going to quite be where we need to be. So the second step is to place a shoulder roll. So you see we extend the chin. When we place the shoulder roll, we really open up that anterior neck. So it drops the occiput down a bit and opens up the anterior neck. But we're still not here for our facial plane or ear-to-sternal notch. Step 3 is add a little headrest. So essentially, you're going to add some elevation of the head based on the size of the child until you get the chin and the facial plane parallel to the ceiling, and you get that ear to sternal notch alignment. So in step 3 here, you can see we have a nice wide anterior neck opening. The face is parallel to the ceiling, and the auditory meatus is in line with that sternal notch. So for toddlers and older children, the goal is the same, but getting there is a little different. So with a toddler, you may have more of a ramped position like you see on the left, but still you have that nice face plane, anterior neck is wide open, and the ear to sternal notch alignment. And then for young children or older children, if you will, you're going to have a little bit closer to what you would do an adult, or you may just need to pad under the head to get that alignment.